Managing Director of the Health Informatics Service, and I'm here to introduce you to our annual report for 2019. I'd like to start by saying how proud we are of making sure that all our customers are completely satisfied with the service they receive. This is about making IT work for you. We now support 136 organisations. That translates into over 230,000 service desk calls every single year. We have over 19,000 end users. We pride ourselves on developing our infrastructure to make sure we give the best possible service ever. And that means looking after many virtual as well as physical servers. We also start to develop our data capture. We've created the knowledge portal for the Trust, where the Trust can use the information in that portal to make some critical decisions. We're looking to expand that next year and hopefully share it broader with our current customer base. What I'd like to share with you is some real highlights from last year. The first one being Excellence in Informatics. We're the first organisation in Yorkshire and Humber to be awarded Excellence in Informatics. Level 1. Great achievement. A lot of preparation, but an absolute great achievement, and it's really good to be first over the line. One of our really big important jobs last year was working closely with Bradford and Craven CCG. They're our new customers. I'd like to welcome them to the Health Informatics Service. This was no mean feat. They decided to commission lots of services from us, and that meant a lot of hard work. We met regularly, and guess what? The transition was a complete success. We transitioned on the 1st of April amidst the COVID lockdown, but it went really, really well. I'd like to welcome the new staff, but also say thank you. You've done a great job. Long may it continue. One of the other success stories that we've talked about for a number of years now is the National Pathology Exchange. We already wanted to expand this year to capture more labs, and we've actually done that. But that's been accelerated further from a directive from Simon Eccles. He's the Deputy Chief Executive of NHSX, and what he did is made MPEX mandatory for all NHS trusts on the back of COVID-19. We embarked on a project that meant we wanted to keep our infrastructure as current as possible, so we did implement Office 365. This was always part of our modernisation programme, and it was necessary to ensure that the Trust was compliant with its licences, but also to make sure we kept our base safe from things like cyber security. The outcome of this project meant we are more efficient and we were able to save costs. No annual report would be complete without discussing our financial summary. I'm pleased to say we were able to still give a significant contribution back to our Trust, but we didn't quite hit the target. What is important though is that contribution will actually help invest in the infrastructure that we currently use to support our full customer base. So in summary, we increased our income, which is good, but we didn't quite meet our expenditure targets. But what we have done is we've realigned those expenditure targets. Whilst COVID-19 didn't have a direct impact on this current annual report, it will have an impact on next year. We were able to deploy technology that allowed our clinicians to connect with patients, diagnose patients, and talk to patients, which was really, really important. But we're also able to make sure all our workforce, where possible, could work from home, keeping them safe as well as our patients safe. I would like to end by talking about customer service again. We continue to measure our performance because it still is important to us. We still use the Net Promoter Score to measure our success, and I'm pleased to say for last year we sit at 73%, which puts us in that category of excellence. But I would like to end by saying thank you to you as customers for continuing to be loyal to the Health Informatics Service. Thank you.